save me doing minutes. Yeah. Okay, morning everybody. So yes, I think us here all know each other, don't we? So sort of introductions are sometimes needed if we've got somebody new to the group, but I think we're all familiar with each other, the small number here. So yeah, I mean, I'll just start off briefly, set what's happening with Citizens Advice. Obviously, the big news for us is that Millen have said that they're definitely the funding is not sustainable for the welfare benefit service. So it's currently running till May 26, and we're in the process of looking for funding replacement to service the hospital hubs that we're servicing at the moment. Nationally, there's still some working parties to see if somebody will take over the funding, but it's gone very quiet. So I think we've got to try and do something locally, which is what I'm doing with Garant, our chief officer. So I'll keep you posted on that. But I don't know if anything's happening, any news about the Macmillan funding as a set of things that are Macmillan badged at the hospitals. Is there anything being raised on that at all? I don't know. Claire's had to go, I think. Just looking. But,
Hi, everybody. I don't know if that was questions for me, Sonia. I can barely hear you at all.
Oh, right. Okay, Claire.
Laptop to my ear.
Oh, I was just saying, Claire, nationally, Macmillan are withdrawing the welfare benefits funding in March, and locally we're looking for funding to replace that. I don't know whether the hospitals have heard anything for the Macmillan services in the hospitals, the other services that go on. Is that been affected? Do you know?
Yeah, I think I'm going to have to move because I can barely hear you. But
Okay,
I'm obviously
okay.
aware of the situation with the Macmillan funding with CAB, and it's
Yeah,
we're all
yeah,
slightly devastated, to be honest, as you can imagine.
yeah,
Um, so I
yes,
did see Helen English yesterday, who's actually leaving, sadly. But I did ask her, if there's any further updates, because when they shared the news with us about their plans, I mean, obviously we know the grants have gone, we know the budgets have gone, and
yeah,
their intention is to be sort of focused on communities that are, you know, have social deprivation, I guess. But
yes, yeah, that seems to be their focus. Yeah, yeah,
and I think the sort of impact of all that is yet to be known. And I think the full kind of, I mean, I certainly don't know the full picture, let's put it that way. And I'm
yeah, yeah,
all kind of waiting to hear what's going on. But meanwhile, as a service here, feeling, well, they sort of seeming to be very keen for us to be key.
yeah,
But we're quite concerned about what services we can provide. Um, so, I did ask Helen.
yeah,
The message to us was that the Macmillan were going to be working very closely with CAB to
yeah,
look at other partnership organisations that might
yeah,
support. So I did say, well, does that mean Macmillan's still going to help fund?
yeah,
Uh, will there be, because obviously the feedback from certainly of people in my position is that you're an incredibly key service.
yeah, yeah. So,
So I don't know is the
yeah,
answer.
I think it's you've had very much the same message from Helen that we have. We haven't even got a partnership manager with
I'm
Macmillan.
sorry, I can't hear you, Sonia. Can you give me
Okay.
5 minutes? I'm going to go
Um,
to oncology and see if it's any better over there because I can't.
okay, okay.
All right, give me 5 minutes. I'm going to sprint across the hospital.
Yeah, 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 you carry on.
All right, sorry. Yeah,
No,
I'll be with you in a minute.
no, it does sound like Claire's had very much the same message as we have. We'll give her a minute to get back and perhaps just go back to that if it's appropriate. But Darren, any news from where you are at all?
So I'm working with the primary care network, so we're supporting all the GP practices in Worcester City, and we're taking the preventative early diagnosis initiative. We are working with people primarily with health inequalities. So going into those communities, the most deprived communities, trying to talk to them about prevention, cancer screening, things like that. I'm going and we're actually going to be more community based going forward. This is the way the NHS want it. This is the way we're going to be. We're going to the Worcester Show on Sunday. We've got a big stand there. We're expanding. The way that we advertise. We're looking forward to being more prominent really within primary care in Worcester, and showcasing really what we do and to support people. So some of the things, just briefly, what we do. So if people have got a Worcester City GP, these are the things that we're offering people that they may not know about. So we've got a podiatrist, so treats foot ankle problems, lower leg problems, not toenail surgery and not toenail cutting, because that's more chiropodist, but podiatry. So essentially any foot problems, you can go and see a podiatry for free. These are all free services, by the way, if you are a Worcester City patient. We've got a dietitian who specializes in nutrition and dietetics. So she's brilliant, so anybody with any kind of dietary requirements, whether they might be vegan or celiac or anything at all, she can support. We've got first contact physios as well. So if you have an acute physio problem, then you can go to your GP. They can book you in, not with a GP, but with a physio. It could be face to face, or it could be a remote appointment. We have a nursing team looking after all, everything really that might come to a doctor can come to a nurse, and she can then signpost to a doctor if necessary. But we and I work closely with the nursing team, booking patients in for cervical screening. I make personal calls to people who are overdue their screening. Care home team, so we have staff there. So residents in a care home have got full access to palliative end of life specialised care from our team, and wellbeing service. So we've got people who can support with the well-being. So it's not actually it's not counselling or therapy, but it works very differently, and it's forward focus. So people who need more support can help. We can sort of help find a more suitable service. We've got work well coaches as well, so that connect people with services to keep them in a job, and if they've been just made redundant, so they're kind of losing their way a little bit, we can support them to feel better, to be able to get work within 6 months of being unemployed. And of course, we've got the social prescribing as well. None of it's cancer specialist, unfortunately. So that's really sad to hear that this morning. I wasn't really aware of the extent of it. But then we've got occupational therapy, so people can go out to patients in their homes and assess for aids and equipment, and it's really a holistic service. So physical, psychological, and environmental needs, providing tailored help that promotes independence and improves quality of life, and we've got microsuction as well, which is the removal of earwax and other debris from the ear canal. So there's quite a lot of services there that we do offer patients. I'd say everything really, apart from severe mental health. We can't support with that, but we do signpost. So back to what I'm doing, I work with MAGS as well, MAGS Day Centre, with homeless and vulnerably housed people. Cancer isn't really their main priority at all. It really isn't, even though they're very high risk. But when you get talking to people, they might say, well, I've got this symptom or that symptom. And it's my job to then book them in with a GP. And their practices are great. If I ring up any time of day, if it's for a patient like that, they will find an appointment for them. So that's where we are really. In terms of the cancer early prevention and support, we are going messages out to anybody diagnosed with prostate cancer under the age of 67. we're going to be sending them a text message to put them in touch with the Worcestershire Prostate Cancer Support Group, because we're finding that these men who are diagnosed don't really have that kind of support network within just the general support groups tend to be with men who are retired and a lot older. So there isn't that real sort of connection. If you're at work and you're 55 and you've just had a prostate cancer diagnosis, the best thing to do is find peer support. But it's very difficult when people in your group, and everybody is in the group, is so kind of 20 years older and in a different place in their life. So we're looking at getting a support group for men who are diagnosed under the age of 67 and of working age. Still sending the bowel screening messages to non-responders. Of course, the age has come down to 50 now, so we've got more messages to send, more people to contact, having that conversation with them. And breast screening, supporting the practices to put out all their posters and leaflets, so that women coming in, anyone with a breast really who is eligible, can understand, why they need to have the screening. And then we're actually finding that the most people who do not respond are the people who are first time breast screening people, don't always go for their appointments. So it's encouraging them really. So yeah, that's it really from me. Any questions, please? Yeah, it is quite extensive.
Chris, you raised your hand there again.
Yeah, I've got loads of questions for you, Sharon.
Oh, go on then, fire away.
Yeah. First of all, that's just wonderful. I mean, that's a superb service. So, from my understanding, is it just you in the Worcestershire PCN area that's doing that, or is this wonderful service being actually replicated in any of the other PCNs across the county?
Some of the services are, but because we're a very big PCN, we can afford to put on more services. So I would say that people in the Worcester City, patients in Worcester City, are quite lucky to have all these services.
Yeah.
I would say, looking at the list, I'd say there are physiotherapists, there'll be a nursing team, possibly there'll be a wellbeing service, and maybe a care home team in most of them, maybe occupational therapy as well. But in terms of services like podiatry, dietitian, microsuction, I'm not sure. I don't think there are in all of them. No, certainly not microsuction. But yeah, I mean, I would advise anyone really, if they've got any problems at all, speak to their GP practice and say, do you have any services that can support me with this? Because sometimes even that, the services are changing all the time and expanding, and not all staff in all GP practices are really aware of what's happening and what they're able to refer patients to. But I would say in Worcester City we do have quite a large selection of services to offer.
Yeah. Now, before I come into the prostate cancer stuff, which is a different thing for me, I need to tell you and people on the call about a project that we are putting together with the ICB on supporting and identifying patients in underserved groups, to do some myth busting and talking to them about cancer. So I think I probably need to arrange an off meeting discussion with you.
Yes, please.
Because it's probably a bit more, but for the other people on the call. So, but right in the middle of putting together a project plan with the ICB. So Angus Thompson is the lead. So he's one of the deputy chief medical officers at the ICB, and this is going to cover Herefordshire and Worcestershire. So obviously, being Health Watch Worcestershire, we're just looking at the kind of Worcestershire bit. They've already spoken to Herefordshire Health Watch about this as well. Essentially, what they're thinking about, and we haven't quite finalised the details yet, which is why I need to talk to you probably in a bit more detail, Sharon, is we're trying to identify community leaders, cancer champions, people like yourself, but also people already embedded in various communities around the county who've got access to groups who don't necessarily have a good understanding about cancer screening, for example. So bowel cancer, cervical cancer rates could be better if the people that it was aimed at had a really better understanding of what it's all about. So we're trying to work together with the ICB, people like yourself, and people who are embedded in these groups to actually provide them with a bit of training, to provide them with signposting, I think is probably the best way to put it, who they can signpost people to in order to access experts who can actually provide services for them. And obviously, depending on the PCN, obviously it'll be different in different areas, what is available. So that's broadly what we're trying to do. So the idea is to improve screening uptake, improve the early identification of cancers where possible, do some myth busting because that needs to be done as well.
Yeah.
Angus has offered for the right environment to get some medics to come out from the hospital and do presentations as well. So I think there's a willingness to upgrade all of this. And what you just went through for Worcester, I thought, blimey, if we could do that for the whole of the county, that would be just marvellous. So that's that. I'll pause there. Can I then move on to prostate cancer? Again, Healthwatch Worcestershire have been working together with the Worcester Prostate Cancer Support Group, a really good group of people. Two things really. So absolutely identification of men who are possibly asymptomatic but who have a family history of prostate cancer, and on the maternal line, if there's a close identification of the BRCA1 gene, there's an association there with a higher risk of prostate cancer, and obviously Afro-Caribbean men as well. I know we don't have a huge population, but that's a group as well that we're trying to get access to. So we've put together a positioning statement on what needs to be done, because I have done some surveys over the last couple of years in conjunction with Worcester Prostate Cancer Support Group, and we've reported back to the ICB chief executive that the identification and the service offered to men within Worcestershire County is variable depending on the GP that you talk to. It depends on what kind of reception that you get. So, for example, some men who are the right age group would go and ask to talk to their GP to get a PSA test, for example, and are turned away because they haven't got any symptoms, which, you know, they haven't even been asked, do you have a family history of prostate cancer? So there's things like that need to be sorted out. So again, we're trying to raise the profile of that. And the Worcester Prostate Cancer Support Group regularly run PSA testing sessions across the county. So if anybody's interested in, if you go onto their website, they'll have all the information about that as well. I believe there's one coming up on the 17th of August at the cricket ground. So that's the next kind of nearest one. So I'll stop there. I've been talking for a long time, so I'll stop there, but just want to say, wow, thank you. I need to talk to you in more detail. And if there's anybody else on the call who is interested in talking to me about identifying people who've got access to underserved groups, I'd be very interested to hear from you, so I can talk to Angus about how we can put something together to improve cancer awareness, identification, and uptake of screening.
Yeah. Sorry, Chris, I've changed my email address, so I need to give it to you.
Okay. Yeah. If you want to put it in the chat, or
yeah, I don't know, how do I do that?
Okay.
Oh yeah, I'll do that. Yeah, fine. Okay,
yeah.
Alan.
I'm just putting my hand up physically because it's so long since I've used Zoom.
Yeah.
I don't know how to put my hand up on Zoom anymore. So yeah, my apologies. I think I said, Sonia, I was going to be late into this meeting, so I'm
Good to
really
see
sorry
you,
I've
Alan,
missed most of that. But yeah, I know I'll hopefully see you on Saturday anyway, Chris, and we can
You
catch up
will.
on some
You
of this.
will.
But
will.
yeah, I mean, absolutely. Yeah, I'm putting my hand up because
Yeah.
that's what this Macmillan project is all about as well. So yeah.
Yeah.
I think
Yeah.
it's
No, I'll talk to you about this on Saturday, Alan. But I mean, the group that we're going to see that you've set
Mm,
up, the Carolan community in Redditch, are
mm,
exactly the sort of group that we need to
mm.
find a way to get more detailed information into them in a way that they want to hear it, as it were.
Yeah, cool.
yeah, sometimes, Chris, I don't think it's not always just the patients we're trying to reach. I mean, I live in Herefordshire, but my father-in-law died of prostate cancer and my brother-in-law was diagnosed. So my husband rang the GP surgery and said, I want to start having PSA tests. And that surgery said, no, we don't do that. It's just, he had to really insist that he wanted this test, and it's just
What's a
an
bit, what's a bit
education there to be had as well.
There is. I mean, on exactly that point, if you go into the guidance, this is the NHS guidance. It's not me saying it. It's the NHS
Yeah,
guidance.
yeah,
Every man is entitled to have a conversation with their GP about
yeah,
prostate cancer.
yeah,
So I think we're trying to change the discussion away from the pros and cons of PSA testing to go and talk to your GP about prostate cancer
yeah,
and the risk of prostate cancer.
yeah,
So,
yeah,
so what we would like in an ideal world is if a man or someone in his family phoned up a GP surgery on his behalf, we would want the receptionist or the triage person or whoever it is that picks up the phone. One of the first questions to be, is there a family history of
yeah,
prostate cancer?
yeah,
And
yeah.
that changes the discussion completely, doesn't it?
Yeah, exactly. No, it's an education. I mean, luckily my husband's quite assertive. He gets it, but
Yeah.
there's a lot of people out there that perhaps wouldn't be. So but yeah, that's good. Good to hear that that's being looked at. Yeah, great. Um, okay, so yeah, thank you for that. There's a lot going on in at Healthwatch. Yeah, that's great news. And I might say that we go to the Worcester show on Sunday as well, Sharon. So yeah, we'll see you there. Yeah, it's quite a nice event to see everybody that's locally. Okay, so Andrew, before you have to go, was there anything you wanted to say? Are you busy as usual? Are you?
Yes, yeah, I mean, you already mentioned the funding, but other than that, it's been pretty much as usual for the benefits advice service. So continuing to do a lot of the usual paper attendance allowance. We have seen some
Yeah,
people being switched over onto universal credit. That's been happening more, although I haven't seen a lot of it. But yes, pretty much as
yeah.
usual.
No, you're still doing a sterling job, but as I say, we're taking the view that we can't rely on Macmillan. We're looking for alternative funding to keep that service, that role going. So yeah, I mean we've got well, not plenty of time. We've got time to sort of get something in place. Yeah. Okay. So lovely. Claire, did you want to give us? Can you hear us better now?
Sorry, I was in the atrium thinking, oh, I'll be fine. I'll pull the
Oh
screen.
gosh, yeah,
Yes,
yeah.
and I've got a bit of an IT issue, which is not my department at all, but it's just yeah.
No,
So I've legged it across. I'm now in oncology. So yes, just sort of basically, as you say, with Macmillan, I think we're all kind of waiting really,
yeah,
just to see how things unfold. We do have various meetings, but our partnership manager, as I say, she's leaving next week.
yeah.
So we're kind of, well, as I say before, slightly gutted.
Yeah, no, I
Very
think
gutted.
yeah, we haven't had a partnership manager for a long time now. And
Yes,
same message from Helen as we've had. That's all we know so far. They keep talking about forums to try and look at
that's right.
other
So
ways of
we
delivery.
we're feeding back, and I know the other around the country feeding back, obviously our take on importance of service, to include yours is right up there, obviously. So In terms of what we're doing, it's a lot like Andrew, much the same. You know,
Yeah.
the football continues. I just had a quick look at my stats actually. So for Worcester, this hub, we've had just under 4,000 contacts this year through patients and health professionals across the board. So we continue to be busy. Again, each service is slightly different in terms of how we work, because here in Worcester we have so many referrals and footfall, it's really hard to get outside the hub to get more proactively onto the chemo suites. But we've got 5 excellent volunteers who are beginning to do some of that for us. So when they're here, we get out and get onto the wards and get into the chemo suites. But yeah, we're flat out doing that. We're also running hope courses. So I've got another 6-week one about to start, but we're experimenting just because of demand. We're really experimenting with other types of hope course. So we've got 3 in the offering coming up September and in October, 1 for breast, 1 for prostate, 1 for colorectal. The prostate cancer has run twice already. That seems to be quite popular. So that, unlike some of the hope courses, is for people who are in treatment as well as out. And it's called Take Control because it's a 1-day workshop. The other 2 have been half days. We're going to experiment by trying to do a fuller day, which include a lot of the elements of the hope course, but it's condensed to give people some of the sort of equipment, if you like, to try and take control, and obviously signposting to other services. So they will be coming from primary care, they come from the hospital. So, you know, obviously signposting to the Worcester and Kidderminster Prostate Cancer Support Group. They don't already know about it. But that's kind of all a bit experimental, just see how it goes down. You know, we might look at doing a 2-day one. We are, my colleague Caroline is retiring in October. You know, hoping she'll be replaced. So we're going through transitions and change. But you know, we're here. We're doing our best.
We do what we can,
Do
yeah.
what we can. Yeah, we're busy, and yeah.
Lovely. Thank you, Claire, for that
Yeah.
update. So
Thank you.
questions for Claire at all? Okay. Okay, so would you like to give us an update of what you've been up to?
Did you say me there, Sonia?
Yes,
Who was
sorry, Alan. Yeah, do you want to give us an update what you've been up
Yeah,
to?
sure. Yeah. I'm trying to remember when the last time. What was that? This meeting?
Been a while, hasn't it? Yeah,
It does feel like a while. So I mean, the big. So people will remember hopefully that. So this was a Macmillan funded project. So I'm now, I think it's a 1.5 years in now. So it's a 3-year funded project. And it resonates with a lot of what Chris was saying. It's about working with communities that tend to get diagnosed later or maybe don't take up screening opportunities. So the project is focused on the travelling communities across Herefordshire and Worcestershire, and particularly the Pakistani, Bangladeshi communities round about Redditch, because that's where I've got the most sort of engagement with groups there. So, and in respect to what Chris was saying, it's amazing when you start talking to people, you eventually find that there are groups, and there's a new group being set up actually for the Gypsy Roma traveller community called Circle of Hope, which I think will be a really big step forward in terms of engagement, because you'll then have a community-led organisation that will be able to sort of access networks, gain trust, and allow further access. But anyway, that's a slight aside. But so the project is about encouraging, finding out why people don't get diagnosed, and the barriers they face, and then finding ways to overcome that. So that's the kind of stage we're at. We've done a lot of insight gathering, and community-based research to find out what the barriers have been. And I've got reports that I can send round as well. And essentially, they don't really, deviate very much from what national research has found. So, you know, within the Pakistani community, taboo subject, people don't talk about it. Some cultural constraints within the Gypsy Roma traveller community, a lot of the barriers around discrimination or perceived discrimination, which is real to them, even if it's not real discrimination, that they're certainly kind of feeling that way. But so that's kind of where we got to, and then we had we're now looking at ways to sort of develop, test, and refine ways to encourage early diagnosis and, you know, take up screening opportunities. So with that in mind, we had a big event at the Redditch Central Mosque, and we had a sort of health and wellbeing event to kind of use as a hook. But when people were in there, we did some co-design. We were working with this co-design agency, and we've looked at some ideas. And again, Chris mentioned health champions. That's something that keeps coming back. You know, trusted community voices, advocates, chaperones, health champions, call them whatever you want, but a number of different roles. But a lot of the solutions that we're coming up with and testing out and starting to test out are community-based solutions. So I kind of think, yeah, that's it. In terms of other updates within that, as I said, there are, sorry, I've just picked up the tail end of Chris's update, but there are some community kind of trusted partners, the Kerala Cultural Association in Redditch, the Ansar Hive in Redditch, which is a Pakistani women's empowerment organisation, and there's others. And I say, with the GRT community, we've got Circle of Hope, hopefully getting charitable status soon. So that's just to give you a flavour of what's been happening in the kind of engagement world. But I'm happy to answer any questions because it's a bit unstructured.
So Alan, is Circle of Hope, is that Abby Smith doing that?
That's Abby Smith, yeah.
Yeah, we had a meeting with her. So she wanted to like a referral route in for.
Yeah, no, she's absolutely brilliant. She's working with her and Stacey Hodgson, and there's a few others. So there's been, in the ether, there's been a few things kind of bubbling away. The University of Worcester have got Peter Unwin, and he's a great advocate for the travelling community. And another guy, an academic now called Gyoza, which I can't remember his second name, and I probably couldn't pronounce it even if I could. And I think he's Hungarian, and he's apparently kind of one of the world's leading experts on the different travelling communities. You got the council service, and then you got some engaged kind of individuals like Stacey Hodgkinson, who works with the university as well. Now Abby Smith, who's working a lot with the Gypsy Roma traveller friendly churches. So these things have been bubbling away, and it's all now seeming to come together. And we're hoping to set up some sort of partnership group to support Abby and Stacey and work closely with this group called Circle of Hope. So yeah, I'll keep people posted on that. But anybody that's interested, we are going to try and set up, just email me, and we are going to try and set up a sort of partnership group, including public health as well, and try and support as much as possible with any funding that can come their way or any other training, you know. So for example, health champions, cancer champions, that sort of thing, just to find ways to support them.
Alan,
sorry, you're on it. Yeah.
Alan, could you put your email address into the
Of course
chat,
I can.
please? Because
Yeah.
I won't have it now. I've changed mine. Thank you.
No worries. That's fine. Yep, we'll do. Sorry, I sort of heard Sonia saying something, but you were on mute, Sonia.
Sonia,
Yeah.
you're on mute.
Yeah.
I can't remember even what I was saying. I was probably just agreeing with what you said. I said, particularly as we met with Abby not so long ago, she's just doing so much in a wide area. Yeah.
Yeah, definitely.
Yeah.
Where's Abby based? Sorry.
Yeah, well, she actually lives near Pershore. So she's in I think she's got a piece of land, and she's built a like a, what do you call it? It's like a static, I think.
Yeah.
But yeah, so Circle of Hope is just on the cusp of being registered as a community interest company, but it's going to cover Worcestershire, Herefordshire, and Gloucestershire.
Yeah.
But like I say, that's going to, I mean, if you go to, say, in the southwest, Devon, Cornwall area, you've got Cushty Bog. Up in Leeds, you've got Leeds Gate, you've got Lincolnshire Travels Initiative. There's a lot of pre-existing stuff around, and they do amazing things. And so this has been something that's been missing in Herefordshire, Worcestershire for a while. So I think it could be an absolute sort of game changer.
Yeah. Okay, lovely. Thank you, Alan. So, I think that's most of us. Oh, Joe, I don't know if you're with us, or do you just wanted to update us from the Hereford Macmillan team?
Yeah, I'm here.
Hello,
Sorry, I haven't got a camera on my computer, so hence that you can't see me.
All right.
Just really to echo what Andrew was saying, in Hereford, the benefits team, we are busy. Referrals still coming in, which is great. We've got a little bit of a backlog of referrals at the moment because we've had staff leave because it's holiday time, but we're working through those as quickly as we can. We're also working really closely with Rachel at the Cancer Information Centre at the Hereford Hospital, and we're doing weekly appointments there when needed, which is working really well. And we're supporting Rachel. Rachel's had an impact on her service because a lot of the cancer support workers, their roles were coming to the end of contract and they've not been renewed. So that's left a huge gap for the Rachel and her service. So yeah. So all okay in Hereford here. Thank you.
Oh, lovely. Thank you, Joe. Okay. I think we've sort of been around there. It's good even when it's a small group just to catch up and share the news, because I can then share it to the whole mailing list and they can just have a look at the recording if they want to. So yeah, if you think of anything else you want to add, Claire, yeah.
Just a quick, one of the coordinators in Northampton has just completed a project on about cancer champions. I don't know whether you want me to send you her email link just out of interest.
Is
Sally.
it?
I think it's Sally.
Sally Maya.
Yeah.
Maya.
Yeah, I put
Sally,
Ben.
yeah.
I put Ben in touch with her. I think he's had a chat.
Yeah, because
our
Ben's
project
now
manager.
there's a Macmillan, I can't remember, it's Community Practitioners Forum or something.
Okay.
That's the way Macmillan seem to be going.
Right.
Like using sort of forums and networks to sort of maximise their kind of reach, if you like.
Yeah.
So Ben's now involved in that forum, which the next one I think is next week or the week after. It's called the Community Practitioners Forum, and it's and Sally's on that. I'm on it, and it's
cool.
run by Leon Sewell, who's
That's right.
the
Weirdly,
relationship manager for the West Midlands or something. Well, I don't think they have the West Midlands anymore. I think it's called North.
I think, funnily enough, I've just been told that he's my go-to at the moment as well. That was as of yesterday.
Oh, Leon.
Yes.
Yeah, so Leon used to be an engagement manager.
That's right. Yes.
Yeah, and then he's now this relationship manager. It's all because we've got a new partnership improvement quality leader, whatever they're called.
That's right.
And and that'll be your new one as well because Helen's leaving, isn't she?
That's it. Yes, that's right.
Jane Owen Pam.
Oh, well, you're ahead of me because
I think that's true that they've all got massive areas now.
I didn't think she'd been interviewed yet, but that's more than I do.
Oh well, maybe not. But I thought Jane would just be taken because she's they've got it's partnership improvement quality lead or something like that.
That's it. Yeah, they've all changed their names, haven't they?
Yeah.
But, there's various, as you say, Alan. There seems to be all these sort of committees and groups that are coming up. So I've just signed up to the professional advisory. Just I think to keep your head in the game as much as anything.
I know.
But yeah, fingers crossed it'll all be a good. Nobody likes.
Yeah, I mean that's 50% reduction in Macmillan's core workforce now.
Yeah.
That's
a lot.
Yeah.
Massive. Yeah.
Hey ho, but we're still getting great feedback and good cover. Like I say, we've got the volunteers. I think we've got now. They've got really good transferable skills from ex-nurses and a good workforce. So obviously more and more we have to rely on them. But unlike other trusts, bit of a personal bugbear. we can't get onto databases, they can't have laptops, email. So it's there's only so much they can do, so they can't send the CAB referrals because it's more through the portal, but they're a very good support to us, and we'd be lost without them now.
Yeah. Shout out to volunteers, definitely.
Absolutely. Yeah.
All right then, folks. So yes, I'll send the recording round, and I'm just looking forward. If we decided we were going to do it 4 monthly, didn't we? So 1, 2, 3, 4. We'd be talking end of November, December. I'll have a look at my calendar. I've got some leave to plan in, but I'll send a potential date round with the recording, and we'll be getting near to the end of the year, which is a bit frightening.
Where's that gone again?
All right, we'll have a good day and rest of it, and take care all. See you soon.
Thank you.
Thank you.
Bye.
Bye-bye. Bye.